People are just joining, so we'll give it a couple of moments.
Yeah, that's
So
fine.
to join. So we have a few people already. So hello everyone. Today we have one of our mentors, Victoria Betton, and her team talking about building a successful digital health project with a tech partner. So I'll hand over to Victoria and she can start. Thanks, Victoria.
Thank you, Polly, and hello everybody. So yeah, we're going to share some of our...
Sorry, I didn't mention that if anyone has any questions, as usual, please put them in the Q&A box or the chat box, and we'll get to them at the end of the session, if that's okay. Thanks. Sorry, Victoria.
No, that's okay. Thank you, Polly. Hi, everybody. Okay, so yeah, we're going to take you through some of our learning about how, as entrepreneurs and startups, you might choose to work with a tech partner, either to completely support you with all your design and dev side of things, or maybe to augment or enhance some of your in-house capability. There's different ways of doing it. But first of all, if we move on to slide 2, I will just do some introductions. So I know some of you, and as Polly said, I'm a mentor on the programme. My name's Victoria Betton. I work for Mindwave. I'm a social worker by training. My background is many years in the charitable sector and the NHS, and I joined Mindwave to help grow the impact of the business in December. Sarah, over to you.
Yeah, I head up the design team at Mindwave. Been with Mindwave for over 3 years now. Before that, I've worked in-house at a cancer charity as their UX manager, and also agency side for most of my career, predominantly working on health or charity related projects.
Thank you, Sarah. Elle.
Hi everyone, I'm Elle. I'm a product manager at Mindwave, and for the past 8 years I've worked in a variety of sectors such as travel, charity and events in project management or account management roles, and I moved to Mindwave to put those skills to good use for something really worthwhile, and I've also been in Mindwave for about 3 years.
Thank you, Elle, and we're really pleased to have Arden join us from organisations Thalamos. So Arden, over to you.
Hello, my name is Arden Thomason, and I am the founder of Thalamos, which we started back in 2018, and which supports clinicians and mental health providers with digitisation of the Mental Health Act.
Thank you, Arden. So if we just move on to the next slide, very briefly about us at Mindwave. So we're a digital health company. We have a full stack in-house dev team, and we do design and project management. We work with the NHS, we work with academia, we work with charities and organisations with a social purpose more broadly. We're a spin out from South London and Maudsley, from the Maudsley's NIHR Biomedical Research Centre. That's a mouthful. And we started in 2014. Our chief executive, as was Kumar, who's now in a director role, has a background in the gaming industry. So we've got a really strong creative industries background and expertise. We understand healthcare and we understand academia. So that's a little bit about us. And I guess, as well as the things I've already described, we've been working with Thalamos for the last bit of time, and so we've been developing expertise in how we can support startups and entrepreneurs in the digital health sector realise their goals and ambitions. So I don't know whether you want to say anything more, Arden, about just in very sort of broad terms, just about the contextual stuff about how we work with you as a startup, just to get us going.
Sure. So well, you guys basically build the technology that we're creating as part of Thalamus's proposition. So I'm not a technologist, neither am I a clinician. It's important to say I arrived at this world kind of a slightly convoluted approach. My dad's a psychiatrist, so acute mental health care has always been a topic of conversation, and it's always been differentiated from other kind of mental wellness or well-being and those kind of things. So I've always had a quite close awareness of acute mental health care, but in 2016, a friend of mine, close friend of mine, was sectioned, and then shortly afterwards, my best mate's dad had quite a nasty run-in with the Mental Health Act. So I started, it kind of piqued my interest, and I started pulling at the thread of why, in a time when you can FaceTime your relatives halfway around the world, we were still managing a crisis care pathway by moving around paper form. It didn't seem a very sensible approach, so I started pulling at that thread for a while. But as I said, I'm not a technologist, so if I wanted to come up with a digital solution, I needed to find some people to work with. I ended up finding Mindwave, and it was a very good find as far as I'm concerned. And we started working together at the beginning of, towards the back end of 2018. And 2 years on, well, not quite 2 years on, 18 months on, we are still working together, and you guys have been responsible for building the technology that we now share with providers.
Thank you, Arden. So if we move to the next slide, that brings us nicely on really for who this session is for. And I guess particular to digital health, there are, as many of you are, oh, I think all of you are, clinicians, either people with sort of lived experience, maybe from a personal experience of services or connected to services as Arden described, or as clinicians, entrepreneurs who found a problem to solve, a potential solution, but haven't always got the tech background that maybe startups in other sectors might have. So this session is really to help you think from our learning, if you do decide to partner in some way, what are the sorts of things they could help you with, how you work together to build a successful product or service, and maybe some of the things to avoid as well. So this is very much about sharing our learning, our journey, and what we've tried to elicit is some of the things that you might not have thought about that might be useful for you to think about in that journey, wherever you are on that journey. So just to reinforce those points on the next slide, then we'll help you think about the do's and the don'ts, and we'll talk with Arden about Arden's experience to help illuminate some of those thoughts in practice. And we're going to run this as a bit of a conversation that I facilitate, and hopefully we'll leave a little bit of time for questions and answers at the end. So in terms of takeaways on the next slide, we'll help you think about how you set requirements, how you work collaboratively, what partnering with a tech company might mean for raising investment, how you build a successful relationship, and ultimately how you get good stuff done, which is what it's all about. Okay, so just before we start the conversation, just a little bit of context, and you might have seen a number of sort of pathway models out there. This one's from Nesta, the HSNs have one as well, but just thinking about that typical, this describes it in a linear way, but of course it's not linear, but that typical pathway where you start thinking about ideas, problems you want to solve, opportunities and challenges. You start to prototype, wireframe, put together some ideas. You start developing, testing, making the case, building the business case. Then you get into the full development, thinking about how you implement, and then hopefully with a fair wind behind you and a receptive NHS or other client, you start to grow, spread and scale your product. So we're sort of helping you think particularly about those very early stages, getting the right things in place that mean that you're in a really good position to go through that journey. So anyway, I'm bored of hearing my voice now, so I'm going to open this up to the next slide about something that I hope that you will all be very familiar with. And some of these things will be very familiar to you, and hopefully some of them will be less so. So be the problem expert. So what's the problem? Who has it? And of course in healthcare we've got a bit of complexity, because sometimes the person with the problem isn't the person that will, well, the user and the buyer are not always the same person, as many of you will know. So Sarah, could you maybe just start talking a little bit about user research, and then we can think about how we supported Arden and Thalamos, but talking about sort of understanding the problem and how early designs can help that process.
Yeah. So I think one of the main problems when we're looking at discovery and even user testing is that people don't know what they want. So your questions are going to really guide the answers that you get. And often your users aren't actually sure what the problem is because they're only experiencing the consequence of that problem. So your user research really needs to invite people to tell you what you've got wrong, because that's how you learn, right? You learn from your mistakes. So I think particularly what we found with Thalamos was that we did user research, and yes, it validated a clear problem and a clear issue. But when we started drawing things up and getting it in front of people, it really started to identify the core of the problem, you know, the source of it, rather than the consequences that people were experiencing. So and I think what worked really well with Thalamos was that we got some click-through prototypes out there really, really quickly. So people could start looking at it and telling us what we'd got wrong. So, you know, invite people to challenge your thinking, to make sure that you've understood the problem, but also that they've understood the problem. And I think the example that I gave last time, I used to work with Macmillan Cancer Charity, and I did some research into their tribute funds platform, which was fundamentally broken. But everybody that I spoke to and tested with loved it and couldn't tell me that they'd had a problem because they loved the brand. So it was only really when I started digging into it, saying, okay, well, talk me more through how you got there and what's going on here. And they, oh, well, I had to call IT. And I had to phone for support, and I couldn't do it myself. Someone else had to set it up for me. So really trying to look past what people are saying, and what the true experience is also really important, and allowing yourself to learn from those mistakes really quickly and change direction. Okay, we thought the main problem was going to be A, but actually it's totally different. So let's change what we're planning to do. And with click-through prototypes, you haven't lost too much time. If you can get those out quite quickly, then you can iterate and adapt rapidly.
So it's a really short, fast, quick way of getting something tangible in front of people that they can respond to, rather than talking about abstract ideas, but it's not like a huge investment of time and effort. Arden, I know you have a lot to say about understanding the problem you're trying to solve, and your experience has been that the problem you thought you were trying to solve turned out to be quite a different one. So could you just talk us through that, and then how using prototypes help that process?
Sure. Well, I'd echo a lot of what Sarah said. Really, is it's understanding the problem and who's got the problem, and what the problem really is. So we started with a kind of lack of technology in mental health care, realised that was an issue, and then we kind of went to try and address that, and realised that it wasn't quite the issue, or maybe that was too big, that was too broad. Then we looked at paper. We started to think that paper was the problem, and so we tried to start to fix that problem, and by replicating the paper forms digitally, so that you remove all the problems of paper, the kind of common handwriting errors and just things that people miss when they're doing a mental health assessment at 3 o'clock in the morning. So you can kind of design most of those out. So you think that paper's the problem, but then you really get down to the fact that actually the problem is this is a live environment that operates between 5 or 6 different institutions, and the problem is one of interoperability. And how do you get all of these different legacy systems to be able to talk to each other. You know, you could be in any one crisis pathway, you might be talking about two different NHS trusts, local authorities, police, private ambulance providers, an independent doctor, all expected to kind of communicate and interoperate. And so actually paper is a problem, but it wasn't the problem. Paper was actually the solution, the only solution that they had to the problem, because paper was the only real world interoperable resource that they had available to them to be able to execute a crisis care pathway. So we've gone from there's no technology, they need help, to the problem is the paper, down to actually no, the paper is the solution to the problem. The problem we're actually trying to solve is this real world interoperability, and technology gets in healthcare. Every conference I go to talks about interoperability, and they normally talk about it from a technical point of view, and how do we get this system to talk to that system, and open data standards, and etc. All very worthwhile and very valid, but they often don't survive a messy situation with multiple institutions involved. And so actually the problem we are trying to solve is, how do you get 5 institutions, maybe 10 individuals from 5 institutions, to be able to collaborate effectively around an individual and their relative at 3 o'clock in the morning in the middle of the New Forest with no signal? How the hell do you do that? And that's the problem we're trying to fix. And paper is, and we're not there yet. We've got huge progress, but we've not delivered the panacea just yet. But part of that was fixing paper along the way and digitizing a lot of that process. So it's almost impossible, we found, to conceptualize the problem. And you have to start trying. You have to start fixing the problem that you think there is, and constantly interrogating and challenging your assumptions and your hypotheses. And the clickable prototypes, etc., were very, very good to be able to do that, because I'm very aware of the audience is, but bluntly, the mindset of most clinicians is such, and the kind of personality types is, they're not actually great at conceptualizing what a solution is going to look like. They're very good at interrogating the problem and looking at things scientifically, but conceptualizing a solution that they're less good at. People with a mindset like Sarah's and Els are very, very good at conceptualizing solutions, and therefore they can draw them up. But then you need to go back and say, well, does this fix the problem? And then again, clinicians are very good at saying, actually, no, it doesn't because of this, or it doesn't because of that. And then you're into that process of learning. So really understanding the problem, it's almost impossible to conceptualize, but the prototypes help you get there.
And I think, to add to that, none of that work, when you have to change direction or you realize that that's not the problem, none of that work is lost, because in doing that process, you are becoming the expert in that problem. You're understanding all of the moving parts around it, as well as the problem that you're actually trying to solve. So none of it's wasted.
I completely agree. Yeah, every time we go and talk to a NHS trust or whoever it is, they're asking us questions that we already know the answers to, which is awesome. And why can't you do it like this? And we can say, well, this, because we do have that in-depth knowledge now.
It's fair to say in healthcare that even though something might seem quite simple on the surface, all roads lead to complexity and interoperability. And I guess we've got a clinical audience here today, and you will know your bit of the system really well, and you might know lots more, but there are so many other moving parts, as you said, Sarah, and so many other stakeholders, whether it be administrators, managers, commissioners, people accessing services. There are so many moving parts and so many stakeholders who need to have some potential interaction with your product, that understanding all of those and getting something in front of them that they can respond to can be quite powerful, I think, is the message. Okay, cool. Let's move on. So this is one that, when we were preparing this session, wouldn't have struck me as an important one to to think about, but actually turns out to be quite powerful, which is why we thought we would bring it into this session. And that's about creating a brand, and it's really about how you build trust very early on with your potential investors, but also your potential users and purchasers. So I don't know who wants to start here. Do you want to just talk a little bit about brand first of all, Sarah, and then Arden, you can talk about what that meant from your point of view. But Sarah, why is brand so important?
I think exactly as it says on the slide, it's building trust immediately. When you feel like an established business and you put a click-through prototype in front of somebody that already looks good and looks professional, you're going to get much better feedback. If you're presenting typical wireframes, typical click-throughs that are just grey boxes that don't really look like anything, that's going to take away focus from the product that you're trying to test with. I think, good design you don't see, bad design you do. So you want to focus on the actual product itself, not what it looks like, but it needs to look great in order for that to happen.
Arden, you when you started working with Sarah and Elle, you worked on a brand pretty quickly, and you've got a really neat website. Just how important were those sorts of things in the early days?
Really important. They save time and money, and brand. Lots of people overlook brand, and I did in a previous organisation, and think, well, we need a logo, and we need a logo, and we need a look and feel, and we need all that bits and bobs. But actually, it's much more than that, and it doesn't have to be that complicated. And you just need to get a professional to do it for you, and it's not hugely expensive. It seems like a lot, but it will save you money in the long run. So what we did, and it wasn't clear at the time. It felt like a huge amount of money at the time. But in the early days, we were introduced to a designer, a freelance designer, who was very good at putting together so-called style guides. And Sarah can tell you the detail of what's in a style guide. But basically, yes, it's a logo, but it's also a look and feel. It's also all the typefaces and fonts and everything else. That cost us $2,500, which sounded like a bucket load of money at the time. And I was hard won over by people to get it done. But of all the money we spent in the early days, and we wasted heaps, and people will, I don't know whether we wasted more or less than other people, but you make bad decisions, and they're always expensive in startup land, sadly. But one of the best decisions we made in the early days was this style guide. And the reason is it just saves time every time. Every time we're putting out anything, whether it's an investor deck, whether it's a website, whether it's a slide for social media, whether it's a job description, whether it's the actual software itself, there's a brand map there already. We don't have to make it up. We don't have to say, well, where does our logo go and how does it fit and what font are we using? Is that the same on Apple as it is on Microsoft? Is it none of that? It's all there. All the colours are there, and it's an easy document to do. So I think particularly in healthcare, it has to feel. It has to be quality, but it also has to feel quality. It has to give confidence to the people who are using it, particularly if you are something new, and particularly because so many clinicians are burdened with crap technology, that as the new kids, you don't want to look like all the crap technology they used to. You want to look these days more like a consumer piece of technology that's intuitive to understand.
Arden, I don't know if this is a fair question, but you said there was loads of things you regretted spending money on or wouldn't have spent money on. Just out of curiosity, if you had to give this audience some advice about what not to spend money on in those very early days, if you were spending your hard-earned cash, $2,500 on design, what would you say was a waste of money?
First website's too expensive. We built it in the jazziest, most cutting-edge website language, and of course it didn't work on NHS computers because NHS computers are IE1 or something, whatever it is, and so that was a waste of money. We should have just knocked up a basic WordPress site using our style guide. We sponsored some events we didn't need to sponsor. What else did we do? Can't remember. The biggest one though is we picked the wrong technology partner to start with, and we dropped an embarrassing sum of money into a relationship that didn't work. And I was aware that that was not working about a month into a 3-month program, and I didn't fire them. And I don't do many regrets, but I knew I should have fired them and I didn't. And that cost me a lot of money. And in the end, we got to the end of that piece of work, and yeah, it wasn't, you know, it's in the bin. It's not been used. I'm not sure anything came out of that piece of maybe a couple of bits. Maybe I'm being too harsh, but there's certainly nothing that's still here really now is of use of that piece of work. And it cost us time. That cost us not just 3 months, but then we had to get back up to speed. So it probably cost us 6 months of wages and 6 months of money going down the pan because I didn't follow my gut that it wasn't working after month 1.
That's so good of you to share that, because I think that's going to be a really useful insight for people. And towards the end of the session, we're going to share some do's and don'ts about the sorts of questions you might want to ask a potential tech partner, because you've got to have the right cultural fit, you've got to have the shared values, but also you've got to have someone that you can rely on. So there's all sorts of questions that you might want to think about asking. So thank you for going there with us, Arden. Right. Okay, we're going to bounce back in another direction now. And this is probably one that's going to be the most familiar to all of you because you're all clinicians. And it sort of builds on the brand thing. And remember, the audience isn't just, it's the person who might be paying, it's the person that might be sponsoring, might be all sorts of different stakeholders you need to engage. But actually, there are a lot of constraints. And Arden, you talked about interoperability, but actually, as we all know, people are under a lot of pressure, never more so than now. So even just basic things like having to log into a different system can be a barrier and shouldn't be underestimated. And just because you're the advocate and love your technology, you might be prepared to do that extra step, but that's not to say that the 3rd, 4th or 5th user might be prepared to do that. Elle, could I bring you in here maybe and just talk about when you're managing projects like this? So you're sort of standing in between a startup like Thalamos, between the design team, between the dev team, helping coordinate and everything run to time. You must see the sorts of things that are really pivotal and you need to think about when you're trying to engage different audiences.
Yeah, I mean, it goes back a bit to what the others were saying about the problem, especially with the clinical audience. I mean, it's become very clear to us over the years of working with clinicians that any product that you put in front of them, if it's not going to enhance their lives or enhance the kind of work they're already doing, they're not going to spend the time to kind of learn a new system, log into a new thing. It's really got to kind of arrive as a solution to a problem that they're already facing and be an obvious step for them in their day-to-day lives. And so we kind of try and work with all of our clients, or with Thalamos, we did lots of in-depth interviews and things to kind of challenge assumptions, but then make sure that the product that we built was something that is very easy to use, and it's it's not being too fancy for its own good. It's solving like the crux of the issue first, and then kind of iterating as it goes along. And similar to what's been said, also is it's also not being afraid to change direction. When you realise that something you've planned to do is actually not at all going to be received well by the clinicians or by people that are using the product, don't be afraid to pivot and do something different. It's not a failure at all. It's actually good to do that earlier on. Better that than further down the line.
I think when you pivot like that and you can go back to your audience and say, look, we listened to you, we've changed this because of what you said, is it working for you now? Then you can really start to create advocates for your product as well.
Sarah, could I invite you to say something about the beauty of simplicity? Because I think it's really tempting to want to boil the ocean when you've got an idea to solve a problem, and things can become complex and you're trying to do 100 different things. Just say something from a design and usability point of view about that MVP thing, about just doing the simplest thing first.
Yeah, so I think making sure you've got your user stories nailed down is really important, and then prioritizing them. What are the things that you must have to make this product work? And I think good practice when you're looking at page design or layouts is, what is your most wanted action from your user on that page, and is it really clear to them, and can you strip everything else out? And if so, do.
Could you say what are user stories? And again, I apologies to people who are familiar with this sort of language, but for people really early stage, they might not be familiar with the what a user story is.
Yeah, so when you're doing your research and your discovery, you should really be trying to understand what the pain points are, what the problems are that you're trying to solve. And then you should be really thinking about solving the problem rather than designing features. So user stories are a really good way to make sure that you're always coming back to the need of your user, rather than thinking about, oh, I want to design this particular feature or piece of functionality. So your user story would be structured as a user type. So as a patient, or as a clinician, or as a carer, or as an administrator, I want to be able to do X so that I can achieve Y. So you're always looking at what is it that the person is trying to achieve when you're writing your user stories, so that you're solving their problem rather than just creating features for the sake of it.
How do you find this language and way of working, Arden? Because it must have been quite new to you, not having a design or tech background, sort of using user stories and solving problems rather than thinking about features. Was that challenging?
Was it challenging?
Or different? I mean, so my background, you know, and I'd done many years of patient and public involvement and involving people in committees and doing surveys, but actually getting people involved in user research and co-designing with people and understanding the problems they're trying to solve was quite we tend to be quite service orientated in the NHS. But this language of design is quite unfamiliar to some people as well. Did it make sense?
Okay. It kind of did make sense to me. Coming from a commercial background, you've always got to ask your customers. You don't have to listen to them; they can be wrong, right? But you have to ask them, and you have to see what they're saying, and you have to know who they are. You really have to understand who they are and how much time they've got and what they're doing and whether they want to log into a new system or not. And you've got all that early adopter curve. I kind of have a bit of a view that there are very, very few early adopters. It's not really a kind of bell curve in healthcare for adoption. It's much more of an S curve really, and it takes a much longer time. Everybody's further down that spectrum. So first thing we did was build a steering group, because we're not clinicians, so we wanted people around us to help us and to speak to. But I think what's key, and I'm yet to be proven right, but certainly ultimately I make the decision, and I'm either right or I'm wrong, and loads of stuff I'm wrong, and hopefully enough stuff I'm right on. But if you do it by committee, it'll be terrible. So you have to seek advice, but you have to be able to make the decision. And in making that decision, I think you have to really challenge your assumptions. And I would suggest that's probably more true. I don't know this, but I suggest it's probably more true for a clinician than it is for somebody coming from outside of this world. Because I was fine to turn up and say, well, I don't actually know, so I'm here to learn. But if you do already know, I would suggest that challenging your assumptions is key. And certainly that's something that we've tried to do. One of the first bits of work we did with Mindwave was a research project, and I was actually I can't remember whether it was my idea or yours, probably yours to be fair, but saying that I don't want any, it's a focus group, but I want no input there's a couple of things we want to find out, but I don't want to be there. I don't want to be able to influence the outcome. Here's a couple of my hypotheses. I would like you to go away and do an independent piece of research, come back and tell me whether I'm talking sense or not. And fortunately, it came back that in the main I was talking sense, but we still learned quite a lot from that. And I was prepared for those assumptions to be incorrect, because if you create your own echo chamber, that's high risk. I would say there's much higher risk than being wrong.
That's a really good insight, Arden, because we all love our own idea because it's our idea, don't we? An investor once said to me, always challenge yourself. When you say something about your product or your idea, is it a hypothesis or is it a fact? And if it's a hypothesis, how are you going to turn it into a fact? And I think that's a really good guiding principle, to always be challenging yourself. Right, let's move on. So we're going to build on that sort of idea about audiences and about meeting needs. To just talk a bit, for those of you that aren't familiar with how a typical sort of design and dev process works, about sort of typically how a tech company would operate in sprints and so on, which is quite different to how we tend to do things in the NHS. So Elle, could you just talk us through that sort of typical sort of sprint sort of process, and how you coordinate the activities to get to a product?
Yeah, sure. So on most of our products, we'll start with a discovery phase, which can take a variety of different turns, but normally involves kind of in-depth interviews and finding out about the problem, doing focus groups and that kind of thing. But the key is just to identify what it actually is that we're trying to solve. And then when we come into kind of designing and developing that, so we'll work in 2-week sprints, sometimes 1-week sprints, depending on the length of the project, but 2 is the most common. And the idea of working in sprints rather than just doing one long process of development and design is that it gives you the opportunity to iterate at each turn. So, after you've done 2 weeks of work, you can test it out with people, you can see whether you're on the right path. And if you're not, it's easier to kind of change tack and amend things, iterate. So it's a very common way of working in the development world, but we find it works well. Obviously, there is kind of pure agile, and then there's agile that actually works within the context of the NHS. So we find that we kind of meet somewhere in the middle, because what we find sometimes with our clients who are kind of clinicians, they already have a very clear idea of what it is that they might want, which kind of goes against the agile way of working. But we tend to meet in the middle, and just doing 2-week sprints allows us to make sure we're on the right path. And then once we kind of have the product, we also work a lot with our clients to kind of roll this out, and it's especially important, I guess, in a clinical setting, working out how that's going to be integrated into current systems, or how it's going to kind of roll out and be of most use, and depending on who it's intended to help, getting feedback from them, so that we can do further phases or just check that it's doing what it should do.
I guess the other thing, depending on the product and who it's for, Elle, but in that iterative process, we'll be thinking about not only sort of NHS standards around data, but also things like clinical safety as well. So building in the particular things that are relevant to a clinical context.
Yeah, we would start that thinking right from the discovery phase, depending on what kind of data the product might be holding. It's incredibly important to thread that through the entire process, especially when working with clinical data, yeah.
And I guess also thinking about the standards that we're using and making sure that we're compliant with sort of best practice in terms of NHS standards. And if we're thinking about something like the apps library, we're thinking about the digital assessment questionnaire and so on. So just thinking about how we build something through that process that is compliant for use in the NHS.
Mm-hmm.
Yeah, okay. Just before we move on, I just want to, this is a bit of a bugbear of mine at the moment, and I know Sarah and I talk about it quite a bit, but the thing that often gets forgotten in this process is onboarding and engagement. So it's all very well building a brilliantly, beautifully designed product that does what it's supposed to do, but if no one knows about it and we haven't got any users, then it's not going to get us very far. So we're always really keen to help our clients think about that onboarding and engagement process pretty early on as well, Sarah.
Yeah, I was going to say exactly that, is that I think the biggest mistake that a lot of particularly NHS products make is not wanting to spend cash on getting it out there in front of people and marketing it. So it is really not a case of build it and they will come. They won't, because they won't know about it. So how do you engage people? And we're looking a lot at the moment. I think Kumar, our founder, wrote a really good article on how games do it and whether that thinking can be brought into clinical and health products, which is really interesting because they get all of the users first and then they build the thing. So yeah, there's a lot of interesting discussion to be had around that. How do you make sure that firstly you've got a product that people want to use, but secondly that they are actually then going to use it?
And using marketing tactics like Google Ads, finding where people are and getting on those channels, whether it be Instagram or whatever it might be. Yeah.
Yeah, and
right.
I think addressing the problem that you're trying to solve, and I think Arden has touched on it a little bit before, is that unless it's really easy to use and it's solving a problem and it's making someone's life easier, people aren't going to do it. Why would they? Yeah. So you've got to be really, really clear about those things.
Thank you, Sarah. Right, next slide, please. We've just got 3 more slides, and this is really, we're now just going to get to the heart of how you create a good relationship. If you are either wanting to outsource bits of what you do or have a tech partner for the whole, for everything you do. So, Elle, we've got a list of bullet points here, but just from your point of view, sitting in the middle as the product owner, what are the things that you found that are really, really important to get right at the beginning so that the relationship works well?
So I think the most important thing is to view the relationship as a kind of partnership, a collaborative partnership rather than a supplier and a client kind of relationship, because that gives you a solid base. So if things go wrong, when things do go wrong, which they do in tech a lot, you're coming at it kind of as a team rather than as a client and a supplier. So I think the key things to get right from the start are kind of how you like to work together, what communication methods are best. It's important to kind of build a relationship and actually get to know the people that you'll be working with as well. And also kind of, as it is in that list, kind of respecting the different areas of expertise in the team is useful as well, which has worked very well with Falamos. Yeah, I mean, all the things on that slide are kind of what I would say are the most important things. But
I think one of the things that you've talked about previously, Arden, thank you for that, Elle, is about flexibility as well in terms of that relationship. And could you maybe just build on some of the stuff that Elle said and maybe touch on that point about needing to have a team that you can work with in a really flexible way?
Yeah, sure. Everything that Elle said is right, and clearly we have a good relationship. I think it has to be, you have to understand other people's perspectives, and I think I have to make decisions that are imperfect. That in a perfect world, if money was no object or time was no object or whatever, that we would do differently. And sometimes for people with a technical mindset, that can be a challenging concept to say, well, I'm asking them to build something that they know is only 60% effective, but I'm saying I can only afford 60% right now. I can't afford full, Rolls-Royce everything, and that's on me, and that's a decision that I have to make. And so the technology partner has to understand to a degree where I'm coming from, and the flip side is I have to understand where they're coming from, and other pressures, time pressures, other projects, different things they're working on, just capacity. There's some stuff that I still can't get my head around, why it's difficult, right? It seems really sensible in my head, but then the feedback comes back that it's really hard to do, and you're like, I don't understand why, and therefore I have to trust that that thing is difficult. There's some stuff, by the way, that I think must be really hard and comes back and it's really easy. My lack of tech understanding, but that's about trusting and being honest, understanding each other's perspectives, and genuinely having a good relationship, a relationship where you can disagree without hurting each other's feelings, and you can have constructive debate and recognise where the decision ultimately comes down to. And my style is that obviously not right now in these circumstances, but my style is you have those, you build that relationship by having cups of tea or drinking a beer or spending some actual time with each other and talking about things that aren't strictly business. I think it's such an important relationship that it has to go beyond just being a transactional one.
So I think there's a really strong theme there around build a partnership. This isn't just a transactional supplier relationship. You need to have a really good shared set of, you need to like each other and want to hang out together, because there's going to be a lot of that. And I think something that struck me in what you said, Arden, was just about pragmatism, about you know, it's not always going to be perfect all the time, but working things out sort of in a collaborative way is really important. Okay, I want to leave a little bit of time for questions or conversation. So this is a really important one, I think, and I don't think there's a right answer. Well, there isn't a right answer for sure. So for some of you, you may have your CTO, your tech in-house. For some of you, you want a tech partner, and for some of you there might be a mix of both, or it might be that you start off external but then you build your in-house tech capability. So I think really, Arden, it'd be useful, and yours is a particular experience, so we can't necessarily generalize, but just tell us about why you went down, you've touched on it, but what your reasoning was for going down the tech partner route, which is the route we're looking at today.
Funny enough, we've just had some questions on that, so here we go. The investors will tell you you need a CTO. To a degree, they're right. In a perfect world, you need a CTO, particularly if you're not technical. I am not technical, so why would you invest in a technology business run by somebody who isn't technical? So from an investor's point of view, I do understand it. The problem is if you're not technical, where on earth do you find that person? And often what I found, and we had a misfire with somebody who we were trying to work with as our CTO, and he couldn't compromise. He's a brilliant technologist, but he found it incredibly challenging. He was the person who built the first website. He found it incredibly challenging that the NHS were using old technology, and all of a sudden he wanted to convert everybody in the NHS to using brand new technology. I'm like, all right, talk about boiling the ocean. That's a different problem. So the CTO that you want, if you don't know them already, as the CTO you want has probably started their own thing. And then there's a load of CTOs you don't want. They're in jobs, they're in big businesses, they're too expensive, they don't understand startups, they can't compromise. The reality is finding a CTO is incredibly hard. So it's having a partnership to get the MVP out. It ultimately became a no-brainer. Then there are big advantages. It's not just there was no other option. There are big advantages. CTO, generally speaking, will go on payroll, right? So that's a headcount cost we have to cover. With an external partner, we can do it on a project basis. Okay, build this, and I know that there's that amount of money, and then we can try and get people using that, and then we can go and get more investment, and then we can do it. So it's mildly slower, but it's much back to flexibility. We ultimately, Mindwave is a resource that we can turn off. That's helpful for a startup without much money. And then you've got talent, right? And I'm not saying it just because they're on the call, but there's no way we could afford as a startup to get access to the talent of Sarah and Elle. Like, we just wouldn't be able to do it. Maybe we could use freelancers, but that's less structured, and how would they have a relationship? So having an outsourced relationship helps you get more talent in that way. And then But in time, we will have to, we are a technology company, we will have to build an in-house resource. So we will have to identify a CTO, but will be a slightly different proposition for that person. We will be able to take our time over finding them, and we will then still be using Mindwave, and it will be an eventual shift potentially. We'll see how that goes. So what I've said to investors' faces before, and I've said it on one of these things before, is I would rather have a brilliant technology partner than a crap CTO. And there are plenty of crap CTOs, and we've got a brilliant technology partner. So, which proposition do you want to invest in?
Okay, on that bombshell. Thank you, Arden. So again, just to reinforce, we're just giving you an experience of this sort of relationship, and there'll be a different decision to be made for each of you, and or there may be some hybrid version. So the last slide from us before we just have a chance to check in on any questions, and it sounds like Arden's answered a few already anyway. Just the last slide is just some things that I'll go through about the sorts of questions you might want to be asking a potential tech partner if you go down that route. So there's definitely something about what their approach is and how flexible they can be. So Arden's talked about that, being able to turn a team on and off, and are they pragmatic? Are they going to want to change the whole of the NHS or understand you build for systems that are commonly in use, those sorts of things. So can they turn off their capacity as you need it? Do they understand digital health compliance and regulation? So we've touched on during the conversation about some of the compliance issues that many of you will be familiar with, but can they help you build for interoperability, for third-party integration, for clinical safety, to meet GDPR, and potentially even for research purposes as well, depending on your product and your offer? Can they offer you that sort of CTO, clinical safety officer, data protection officer role? And will it be a supplier relationship, or do they want to, or are they prepared to do a collaborative approach where you get more than the sum of the parts from your partner really going with you on that journey? And I think without putting words into Arden's mouth, we've done much more than just be a supplier and provide tech support. We've been involved in your journey in all sorts of different ways to try and help beyond the pure dev. We haven't touched on intellectual property, but obviously intellectual property is incredibly valuable to you. So you need to make sure that that's yours, and you own it, and you protect your intellectual property and your copyright. If the NHS is your customer, do they understand it? Do they understand some of the constraints that you will know very well and that we've been talking about? And beyond design and development, do they know how to take a product to market, if that's the help that you want? And just going back to Sarah's point about that onboarding, that engagement, and thinking really early on about how you get this product to actually solve people's problems beyond actually designing something that's beautiful but no one might know about. And that is a more challenging thing than it might appear on the surface. So in our prep for this and in our conversation, those are the sorts of things that we thought were the sorts of questions you might want to ask. Before we hand over to any sort of questions or comments via Polly, is there anything else any of the team would like to add to that? Anything I've missed? No, everyone's saying no. Okay, so Polly, is there anything that you'd like to flag up on, just any questions or comments that we haven't covered?
Yeah, there was a question from a clinical entrepreneur that said, and you might have covered bits of it, but he said, I'm struggling to find good developers and a development team. What would be the recommended procedure to build an MVP? Oh, sorry, it's hold on a second.
I've got it here. Is that from?
I found the odd freelancer to help, but they've not been very good, and I'm struggling to find developers. I'm cautious how to cost effectively to get a product developed. If I go to a big development company, they will be very expensive. If I go freelance, I have no idea if the person is good at doing.
So it's about quality, getting good quality product at a reasonable price.
Yes.
Sarah, do you want to hop in there? What? That's a trick. Or Arden?
Yeah, that's a tricky one.
I faced exactly the same problem. Right? Do you go freelance? Where do you find them? I don't know if they're any good. What's an MVP look like? Blah blah blah. And ultimately, what I did was answer that problem with Mindwave. I know that sounds massively salesy, but it's unprompted, and I've no vested interest in it, I promise. But that's what I did. Definitely don't go to a big company. That's where I made my mistake. I ran a full kind of RFP process, big corporate buying, blah, blah, blah. Guess who won that? The biggest company with the most resources to answer my RFP won that. And then always be where I turned up to the meeting and there's Ross and me and like 8 of them, 3 of which were project managers, and I'm paying them all a day rate. And I just suddenly went, all right, this is a room I can't afford to be in. So I would find other providers are available, but I would find a smallish design and development firm who understand you and who you can speak to easily. And then before you commit lots of money, I would go through the clickable prototype route, and I would go through that, and it's not that expensive. It really isn't. To do that, that's what I did, and therefore, and it seems to be working. So that's my 2 pence.
I guess the other thing I'd add in is, sorry, just before I'll jump to you, Sarah, is speak to a number of companies. So don't go with the first one, and you'll get a sense of when people are quoting you prices and telling you about what they'll do. So you'll get a sense of their values and whether you like them and want to work with them and whether they've got the right expertise. But also there's just, it's like, get a few quotes and get a feel for the sort of money people are talking about, and that'll help you get some sort of comparison. Sarah?
I think that's pretty much what I was going to say as well, is to meet people, chat to them, try and have some informal chats with people and see what sort of sense you get from them. So we met Arden at a conference where Elle and I were doing a workshop. It just happened to happen, but kind of getting out there and learning as much as you can about the industry and what sort of resource is available, because a freelancer might be your best bet, but they might not. But I think ultimately, that going back to that relationship slide, and knowing that you're going to get on with somebody and that they're going to be honest with you and you can be honest with them and you can work things through together, that might be just as valuable as going to a tech partner. So I think you've really got to work out what's best for you and how you like to work.
And see what they've done before and see what other people say about them. So, references, chatting to people that they've worked with before to get that validation. Polly, anything else? We've just got a few more minutes.
I think Sarah's just answered the question, what are the benefits of using a tech partner as opposed to having an in-house engineer? But I think you've covered that, haven't you? There are a couple more actually.
So there's one on, does the CTO have to be someone who can develop apps, or can they be someone who has had experience of founding a tech startup of their own and has the knowledge of stakeholders in the tech or app development work? I think they can be either. I don't know if you guys, Elle or Arden or Victoria, have a different view on that, but I think they can be either. It really depends what you need them for. So some people use their CTO to actually build their platform. They are the expert in the technology and they build the platform, and that's what that person needs. But it might be that you just need someone that can help you navigate the system and understand it. So again, you've really got to look at what your primary need is from that role. And if they are covering one bit, then maybe your technology partner will cover the other bit for you.
Anything to add, Arden or Elle? No.
Not really. There's a couple of other questions. I'm mindful of time, but I would say the same thing. It depends what you want your CTO to do. CTO is not a catch-all title. They come in different shapes and sizes, and identify A, your areas of weakness, and B, your differences in personality. So if you're with Ross and I, Ross isn't technical either, but Ross has a lot of personality traits that I don't have, and sometimes that leads to niggle each other, but most of the time it means we've covered all bases.
Yeah, that's a good place to finish, I think.
Well,
I think we're out of time. It's
Okay.
exactly
There's a couple
1:30.
of people I think might want introductions, Victoria, so can I?
Oh yeah, do you want to do the last slide, Elle, which is the get in touch? So we're really happy to have chats with people. Usually it would be a cup of tea or a coffee, but it's or hang out or something like that. But yeah, get in touch with any of us if you'd like more information. You know, always just happy to have an informal chat. But yeah, thank you very much for your time, everybody. We hope you found it useful and insightful. And yeah, give us a shout if you'd like any more information, any of you.
Thank you, Victoria. Thank you, everyone.
Thank you. Have a good rest of the day, everyone. Stay safe.
Thanks. Bye.
Bye.
Bye.